Hey everyone, Josh here. It's been such an incredible journey sharing clinical updates that shape your pharmacy practice. I've truly enjoyed every minute of learning and growing alongside you through these conversations. But the time has come for me to pass the mic, and I couldn't be more excited about who's stepping in next. Dr. Rachel Maynard will be your new host moving forward. Rachel is a pharmacist with extensive experience across diverse areas of practice and more than a decade focused on developing engaging, evidence-based educational content. She's passionate about helping pharmacists translate knowledge into better patient care. You may also recognize Rachel's voice because she's joined me as a guest on a few past episodes. But don't worry, I'm not going anywhere. I'll still be in my same role here at CE Impact, just working on some new projects and initiatives to support pharmacists and promote lifelong learning. Rachel, it has been such a pleasure getting to know you over the past few months, and I can't think of anyone better to carry the conversation forward. So take it away, my friend.
Well, thanks so much, Josh. And hello, everyone. I'm so excited to be joining you as the new host of Game Changers Clinical Updates. I've admired this podcast for a long time, and I can't wait to continue the conversations that help us grow, learn, and make a real impact in pharmacy patient care. Over the upcoming episodes, we'll hear from practice leaders, explore fresh perspectives, and get practical insights that you can apply to your own practice. Josh, thank you so much for paving the way and for your dedication to creating meaningful dialogue in pharmacy practice. I'm thrilled to build on that foundation and to keep the momentum going. So let's dive in. The next chapter starts now. All right, so today we've got a really interesting topic to tackle, which is looking at a decades-old drug, leucovorin, and some recent FDA action to make it available for a new use. So the FDA recently put out a press release, and the headline is FDA takes action to make a treatment available for autism symptoms. And that treatment is leucovorin. And we'll dig into what that autism symptoms phrase means a little bit more. But since that FDA press release, the American Academy of Pediatrics actually came out with their own interim guidance about the use of leucovorin in pediatric patients with autism. And their guidance states, and I quote, "At this time, the American Academy of Pediatrics, AAP, does not recommend the routine use of leucovorin folinic acid for autistic children." So I think you can tell from that this is a bit of a controversial topic, but we're going to sort through the evidence and come to a bottom line about what all this means in your practice. And I'm so excited to welcome our guest today, Dr. Jeff Wall, who is no stranger to this podcast, but we're so excited to have your expertise on this challenging topic today, Jeff. So welcome.
Thank you very much. I appreciate it.
Awesome. So for our listeners who may not have heard you on the podcast before, and for me too, since it's my first time chatting with you, can you share a little bit about your background, your current role, and why you might be interested in this topic?
All right. I appreciate it. Yeah. So, I'm currently I'm faculty at Drake University, have been for over 25 years now, in the Department of Pharmacy Practice. My practice site is in internal medicine and critical care at Iowa Methodist Medical Center, which is the third largest hospital in Iowa. Have been practicing in internal medicine for about 25 years now, a little bit longer. Been a pharmacist now for almost 35 years. Oh my Lord! And so, at this point, I get routinely made fun of before for my age and stuff. So at this point, but like internal medicine, kind of jack of all trades, master of none. But I mean, this has certainly reached a lot of stuff because I'm also director of the Drake Drug Information Center. And so in that role, we actually have gotten already several questions about some of the recent announcements by FDA and by HHS about several topics in the world of autism, but this was certainly one of them. And we actually just completed a monograph for folinic acid and its potential use in autism use disorder. So, I feel pretty comfortable with the data at this point. So
excellent. Well, then, very happy to have you here to help sort through all that because I think it is a confusing topic, and even the FDA sort of headline that I read is open to a bit of interpretation depending on how much further you read into that news release. So I just gave a brief background and, like I said, just basically the headline. So if you could give a little bit more on what the FDA is doing and why maybe this is coming up now and what's sort of spurring this. And you mentioned some other actions around autism too, and I think this falls in with that. So just a little more clarification on what FDA has said and what they're planning to do.
All right. So autism spectrum disorder is a controversial topic from really the word go. But for those who suffer from it and for parents of children who have it, it can be a devastating diagnosis, and is just a real challenge because, like so many disorders that we really don't understand the cause of, we don't really have a lot of effective treatments for. And so, depending on the scale of symptoms that patients have, it can be unbelievably challenging for day-to-day life, for education, and all sorts of things like that. So, as you might imagine, in a world where we've got patients where we don't really understand what's going on with them, we kind of look around for any treatments we can, right? And this is true for a variety of disorders. And for autism spectrum disorder, there have been studies, very small studies, both at the kind of the bench level, as well as one randomized controlled trial, that have suggested that folinic acid may be beneficial in improving some symptoms in autism spectrum disorder. FDA has basically announced that they're going to use that as kind of the pedestal to look at approving folinic acid for autism spectrum disorder, but also, I think, more importantly, as an impetus for designing and executing large-scale clinical trials, which is really what we need. And I think so. I mean, it's a twofold thing. I think they've signaled, I wouldn't say approval of an off-label use, because I'm not sure that's something the FDA can do. But I think a way to interpret the FDA's press announcement is that it's a signal to healthcare providers that, hey, we're preliminary evidence is promising. We're taking a look at maybe proving this either on its own merits from the studies we have, which I hope I'm not sure how smart that is to do, but that's a whole other issue. But also as a platform to help design and execute clinical studies. Folinic acid has been generic for a long, long time. So it's going to be challenging to find anyone who will do large-scale randomized controlled trials on this, because they won't have anything really to benefit from it.
So yeah, but I think you brought up a few great points. And one of the things that was confusing to me actually about that FDA press release was that they were initiating the approval of this. As you said, it's a little bit not our normal regulatory process for approving a drug. So, so that was, yeah, so very interesting. But let's actually just take a step back for a second and actually look at what they were sort of starting this initiation of process for. And that specifically was for a condition called cerebral folate deficiency. And so I think it would help all of us get on the same page around what is cerebral folate deficiency, which maybe we can refer to as CFD going forward, just for simplicity and ease of use, but also what is that and how is that different or similar to autism, and some distinctions there. Are they sort of equivalent terms, or what are the nuances there?
That's a good question, and from my reading, they're not equivalent terms, but their clinical phenotypes, I mean, how they look and how patients can have symptoms surrounding it are very, very similar, right? And since autism spectrum disorder is, I mean, there's no lab test, there's no imaging test that definitively diagnoses it. Like many of these disorders, it becomes difficult to tell one versus the other. But the former, CF.
Yeah.
Sorry, it'll take me a second.
You can use the full name if you'd like, either way.
Yeah, no, that's fine. I think CFD is better. It is basically just what it says it is, that there's a small percentage of patients that have basically a genetic disorder where they have a mutation in their MTHFR gene, which is a gene that does a million things, but one of the things it's primarily responsible for is folic acid metabolism. And without that, you can't, folic acid doesn't get basically activated. And so you have basically unactivated folic acid with that physiologically active types of folic acid, which is folinic acid, basically are at very low levels. Your whole body needs folic acid, but in particular, your brain needs folic acid, particularly when you're growing. And so this is a small percentage of patients that can have this mutation in their gene that leads to low levels of folic acid in cerebral spinal fluid, that has been thought to lead to some developmental issues that are very, very similar to autism spectrum disorder. And again, just looking at a patient, you can't really say, I mean, okay, well, this patient has met the diagnostic, clinical criteria for autism spectrum disorder. Could they also have this, cerebral folate deficiency? They may well have. It's relatively rare compared to overall ASD, but it certainly could be a possibility. And this is an unusual, folic acid deficiency, or methylfolate deficiency, I suppose, at the brain level isn't just limited to potential uses in autism spectrum disorder. We know that about 10% of patients with resistant depression also have this, decrease in activated folic acid in the brain. And in some of these patients, treatment with methylfolate has been found to be beneficial. So, there's certainly biological plausibility for the fact that low levels of folic acid in the central nervous system can lead to issues. So it certainly stands to reason that that's what's going on.
Okay, got it. So just to clarify, they are not one and the same, autism and cerebral folate deficiency. And cerebral folate deficiency, it is a nice descriptive term because, as you said, it means that folate is not getting into the cerebrospinal fluid. It's not crossing that blood-brain barrier as it should. And so even if they have normal blood levels, it's not getting into that cerebrospinal fluid. Okay, so that's a great distinction. And the other distinction is that people with CFD may have symptoms similar to autism, but they may, it may not be a diagnosis of autism spectrum disorder, and vice versa also. So people with autism don't necessarily have CFD. They are discrete, there may be overlap, but they're discrete terminologies.
They're absolutely discrete entities. But again, the phenotypes clinically can be very, very similar. So that's the problem, is that in a disorder where we don't have definitive testing, it can be very difficult to differentiate the two. And the only thing you can really kind of go off of is that, as we understand it, the cerebral folate deficiency is relatively rare.
Right. Right.
But that's really it. So it can be challenging to do. Yes, they're absolutely two different separate entities, but without advanced testing, it's difficult to tell between the two.
Right. I think in the American Academy of Pediatrics FAQs, it said it's either lumbar puncture or genetic testing is the way to actually diagnose CFD. So that's an important nuance. But again, thinking about that FDA headline to make a treatment available for autism symptoms, they then go on to say initiate the approval of Leucovorin for patients with cerebral folate deficiency, which those patients may have autistic features. So again, there's sort of this blending, and I think it can be confusing, especially if you, like you say, you're looking for treatments for, because there's not one proven target treatment. And so this is why I think it's of interest to a lot of people and people looking for an answer. So maybe with that, we can actually go into Leucovorin and what it has typically been used for, and sort of that mechanism. You touched upon that a little bit, I think, but maybe just clarifying what that drug is and what it's been used for in the past, and what the theoretical role might be for CFD and or autism.
So, I mean, as I think everyone knows, folic acid, is an essential vitamin. It's vitamin B9. It is responsible for a whole host of metabolic processes, not least of which is producing red blood cells, but also developing the cerebral or the central nervous system, peripheral nervous system as well. It's why folic acid is so important to the developing fetus, and why it's critical that pregnant women have enough folic acid. But folic acid is not metabolically active. Folinic acid, or leucovorin, is the metabolically active form of folate that does not require an enzyme called dihydrofolate reductase for conversion. So if you're wondering, well, why can't we just give people tons and tons of folic acid and won't that do the same thing? The answer is probably no, because the theory behind all this isn't that people aren't eating enough folic acid, it's that their body can't convert it to its active form, right? So folinic acid kind of bypasses that, right? It has been available, as you pointed out, for decades, but it's been primarily only used almost, not exclusively, but I'd say 80% of folinic acid was used as a rescue treatment for methotrexate-based chemotherapy regimen. So we would give, especially for non-solid tumor cancers like lymphoma, leukemia that often had CSF infiltration. You would actually give massive doses of intrathecal methotrexate to knock out the cancer in the central nervous system. And those kind of doses were, extremely, could cause extreme sickness and even death in patients. And so we would perform what was called leucovorin rescue. So since methotrexate and all these drugs are folate reducers, we would just give massive amounts of active folinic acid to treat it. So that's the primary use. Now I've used it for methotrexate overdoses a million years ago when we in the tail end of the AIDS crisis. We would occasionally be using high doses of sulfonamide-based drugs for certain types of opportunistic infections, and we'd often require a folinic acid rescue in those patients because, again, Bactrim and sulfonamide-based drugs work by decreasing folic acid levels. So that's primarily where it's been used for. But in the 21st century, even though our use of a lot of these drugs has kind of gone by the wayside in traditional chemo, they still use quite a bit of methotrexate for non-solid tumors. So you're still going to see a lot of that used for that.
And that translates well into the theory around using leucovorin for CFD because, as you said, it's sort of bypassing that. It can get transported, right? Because it can be bypassing. It doesn't need to have that enzyme process to become its active form. It is sort of close to the active form already, and then can more easily cross the blood-brain barrier and then replenish those levels. Is that the idea for? Okay. Yeah, and so, thinking about potential risks of leucovorin, what would you say are the concerns there, like in terms of for any? Yeah,
that's a good question. I mean, from a safety perspective, really there shouldn't be any side effects, right? Because folic acid is a water-soluble vitamin, so is folinic acid. So theoretically, it should be impossible to overdose on it. And certainly we would give huge doses of folinic acid to patients, and for leucovorin rescue back in the day, and we never saw anything from it. So I think from a safety perspective, data on where we used it traditionally has not found significant toxicity, but we're not going to be using it in those patients. Again, biologically, biologically, we shouldn't see big side effects, but we don't know because we haven't done randomized control trials in this population to really find out, right?
Right.
So I mean, again, the theory that some terrible side effect could manifest, I don't, based on the mechanism of leucovorin, probably shouldn't happen, but we've been many times in the history of medicine that we'd be burned by saying, well, this really shouldn't happen, and then it does.
Right. Yeah, so I think that's actually a great segue into thinking about what evidence is available for the role of this drug in either autism and or cerebral folate deficiency, and what FDA is using to support this action, and what American Academy of Pediatrics has sort of said about the evidence, and really sifting through all that to think about, given the mechanism and potentially minimal risk, but as you said, maybe lack of data to support its use in these populations. Let's talk a little bit more about that evidence there, and what would you say?
Absolutely. So I mean, there's been a number of small retrospective or case series that have suggested this benefit, but really when it comes down to it, there's only really a couple of papers that have any sort of scientific rigor to them, in my opinion. And one of them is a paper that came out in Nutrients actually just this year. And I think it gives us some of the biologic framework for the possibility of using this. So this was a study done in China where they looked at patients who had autism spectrum disorder, and now I can't speak about it. But they also wanted to take a look at in these patients who did not have known cerebral folate deficiency, right? So, and they wanted to look and see just in and of itself whether or not they received folinic acid or anything else, that did patients who had autism spectrum disorder have any sort of mutations in folic acid metabolism that might support the use of this drug, right? Because again, if you have these mutations in folic acid metabolism and you're not able to use that, is that one of the potential causes of autism spectrum disorder? And so they had 80 patients in the study. Wasn't a large study, but none of these studies are really big, and basically just did a very in-depth genetic profiling of them. And then they actually did give folinic acid 2 milligrams per kilogram per day in these patients. And again, there was a control group and an intervention group, but a total of 80 patients. And what they found was that only about 60 per patients in the study actually stayed in the study. And they found that patients who had significant mutations in folic acid deficiency. Now, again, these patients had not been diagnosed with cerebral folate deficiency, just that they had these mutations, right? So, and they found that the administration of folinic acid did seem to have some improvement in behavioral issues associated with autism spectrum disorder, and it was certain combinations of mutations, because many times these patients had more than one mutation that was leading to stuff, and they found basically that folinic acid seemed to benefit patients who had these mutations, who had been diagnosed with autism spectrum disorder, but not necessarily with cerebral folate deficiency, if that kind of makes sense, right?
Mm-hmm.
So I think that this study was trying to do two things. They were trying to point out that even if your LP, your lumbar puncture, does not necessarily show that you have low levels of folic acid, that patients who just have the mutations involved with the potential of folate deficiency would still potentially benefit from folinic acid. So I think that's the framework that makes sense, and kind of I understand. But the paper that really kind of got this really kind of launched, and it's the only RCT that's been done, was a paper done in the European Journal of Pediatrics in September of 2024 is when it was published. Very small study, only 40 patients in the study. Patients had autism spectrum disorder, ages of 2 to 10, so this was only done in children. They also received folinic acid 2 milligrams per kilogram per day, up to a maximum of 50 milligrams a day. And it was a randomized controlled trial, so there was a placebo group and an active arm group. The patients also received kind of standard behavioral care, et cetera, et cetera. Like so many disorders like this, there are a million outcomes that you can look at, right? The same with different types of neurologic and psychiatric disorders, where we have these kind of scales. We have endless scales where we measure behavioral disorders and sensory disorders and learning issues and things along those lines. The main outcome they used in this study was something called the Child Behavior Checklist, which is one of the outcomes commonly used in autism spectrum disorder. But they also looked at a wide variety of other these secondary ones as well. They did look to see if the patients had antibodies to folate receptors. And again, their theory was that, okay, so some of these patients have that as well. They did find at the end of the study that there was an improvement in this child behavioral checklist score. The overall improvement was relatively modest. I mean, it did improve things, but it wasn't like, gangbusters. Oh my goodness, I can't believe this sort of thing. But in particular, they found that some of the behavioral issues that they were associated with, some of the sensory issues that are associated with autism spectrum disorder seem to improve in these patients. They also found, not surprisingly, that this was particularly true in patients who had antibodies to folic acid receptors. That was where they got the most benefit. Again, we're realizing that impairments in folic acid activation metabolism may be an issue behind this that goes beyond just this cerebral folate deficiency. Again, they're two different things, but there may be kind of an overlapping role. So that's basically what they found, and the conclusion of that study was oral folinic acid supplementation is effective and safe. Again, it was a small study, so it's kind of hard to say that, in improving ASD symptoms with more pronounced benefits in children with high titers of folate receptor autoantibodies. And so that's kind of the limit. So I mean, we're looking at small studies, and the only randomized control trial was not long acting, or not long going on, and it was only in 80 patients. So as you might imagine, I think the American Academy of Pediatrics took a look at that and said, kind of hard to believe that we're going to approve a drug for a relatively common disorder. I mean, it's not like ASD is something that you don't hardly ever see or anything. I mean, yes, right, super duper rare diseases, 40 patients maybe is as good as you get, but we certainly could do a much larger study, and should do a much larger study, I think, to really show the benefit of this.
Right, and I think you mentioned something earlier on about part of the impetus with FDA is to not only try to find treatments for this very common condition, and try to provide treatment, but also spur additional research, right? Because if we are trying to work with what we have right now, and what you just described is, as you say, not what we would normally see rising to the level of getting this drug approved for this use. So I think that's sort of the interesting part here, is that FDA is taking this action to initiate the approval, but we don't have those phase 3 large multi-center randomized controlled trials with a large population of patients, short duration, as you say, so there's what we would typically expect to see supporting evidence for in terms of safety and efficacy. We just currently don't have. And I know in the FDA press release too, there was a discussion around a systematic analysis, including published case reports. But again, case reports is different than randomized controlled trials, as you're saying. And so, yeah, go ahead.
Yeah, I mean, you're exactly right. I mean, it's always tough, using systematic review and meta-analyses is always an issue anyway. But it is emblematic of the whole garbage in, garbage out sort of thing. I mean, if you have poor research going into a systematic review, you're going to get I wouldn't say poor outcomes, but you're certainly going to get non-definitive outcomes, right? And so if you decide to do a systematic review, it says, we'll take case series, we'll take case reports, we'll take retrospective cohort studies, and we'll also sneak in the one randomized control trial. It's going to be difficult to interpret the results. So yeah, I'm not sure at this point we have enough evidence base that even systematic reviews and meta-analyses are really going to help us come up with the answer.
Yep, that makes perfect sense. Okay, so I think you've summarized sort of where we are now with the evidence, and so what would you, if I was to ask you point blank, is leucovorin an effective and safe treatment for autism? How would you answer that if I was a patient asking, or a parent asking?
I would say that right now nobody knows, right? Right now we have one small study that suggests a benefit, but it suggests a benefit in particular in patients whose own body has a difficult time either absorbing folic acid or converting folic acid to its active form so the brain can absorb it, right? And I think if I was talking to a patient, that's exactly how I would phrase it. We don't know what percentage of patients with autism spectrum disorder have this issue, because we really haven't even explored that yet, not to say nothing about this. So then the question becomes, my child has this, and I really am, anything that isn't particularly harmful, I'm willing to give it a shot. And that's really who we're going to be talking about, right? I think the way we phrase it to him is, I can't tell you if it's safe in these patients because we just haven't studied it. And I think that's why the American Academy of Pediatrics has come out against it and said, we need more data. Again, theoretically it should be fine, but we just don't know. We don't know the dose, we don't know the duration, and all those things. Now, does that mean that people aren't going to be getting folinic acid by hook or crook just to try it, I'm sure they will, right? Families, parents are they're desperate for any sort of treatment that's going to improve things. I get it. I totally do. But I think as healthcare providers and as pharmacists, I think we need to be honest with patients. And I have heard people say, well, it can't hurt them. Well, we don't know that though,
Right,
right?
right.
Sometimes I think we forget that phase 3 studies are designed to evaluate efficacy and safety in the population with the disease. We focus on the efficacy part, right? But we need to focus on the safety part. The other big problem that oncologists have raised, which I think is totally reasonable, is there's in a drug that wasn't mass produced to begin with, because again, how many patients are we going to use folinic acid rescue, leucovorin rescue in patients with chemo? The oncology groups have raised the issue. It's like, well, okay, hold it, but if every family with a child with autism spectrum disorder starts asking for the stuff, what happens when we need it for actual,
great point.
leucovorin rescue in patients? We can't get it,
Great point.
And so, and I mean, and I think that's a very valid point, because, there's actually only a couple of companies that even make folinic acid. I mean, it's not like every company makes it, because A, it's a generic, and B, it's got a very narrow indication. So, I think that's a real concern for cancer patients and oncologists is, when we need this stuff, we need it. You can't wait for a month for it to come back, to get it. We need to be able to use it. So I think there's also a supply issue argument to be made.
Yeah. Yeah.
So, again, it's an unsatisfactory answer, to patients and parents who are very desperate, and I get it. But as of now, I can't recommend it based on the evidence we have. Now, if a patient, insists or harangues their primary care provider, because you don't have to be an oncologist to prescribe this, I think that people will get a hold of it, and they will try it irrespective in many cases, because again, we want an active treatment, and it's like, well, I'm hearing you say this is just basically a vitamin, so I don't know how this could hurt anybody, so let's give it a shot, sort of thing.
Right. I mean, there are sort of the unaccounted for downsides too, like additional pill burden, right? And depending on what else they're taking, does that affect it here? And cost too. We don't really cost, especially if demand does go up as a result of all this, and cost and pill burden and potentially impact on other medication adherence. And I know you phrased it very well, that this is something we obviously want to provide solutions, but we also don't want to provide false hope and have people be thinking it's going to be, a cure-all, and not, when we don't have good data to support even, for even that limited subset of patients where it's being proposed for use now. So it's a challenging one. And I guess even outside of the prescribing aspect, what about people who might be asking about folic acid over the counter, and again, using as just a supplement, harmless? What would you say in that context?
And I mean, and your discussion about pill burden costs. I mean, again, little things add up. You say, well, folic acid is probably only $5 for 100 pills at a community pharmacy, but that adds up when you start adding on. And patients, families who have children with autism spectrum disorder are already paying a lot of money in a wide variety of areas, right? Again, I think we focus that, even in patients where we have okay data, again, in this cerebral folate deficiency, the fact that they're not eating enough folic acid is not the issue, right? It's that the body doesn't know what to do with it. And it's the same argument I usually give for patients with B12 deficiency, right? B12 deficiency anemia. It's like, why are we giving these shots to people? Well, we're giving these shots to people because it isn't that most patients aren't eating enough B12. It's that their body can't absorb it or activate it. And that's the same thing here. So, you're right. Folic acid is probably not going to hurt, someone to take an extra folic acid pill a day or something, right? Again, because it's a water soluble vitamin, but you do have the pill burden, you have the cost, and there's no reason to think it would work because we have exactly zero data. We don't even have these little tiny studies to suggest that there's any benefit in folic acid, and there's no biologic plausibility that it would. So.
Yeah. And I think that can be a compelling argument, when helping redirect some of those conversations too, because a patient who's maybe looked this up and sort of has some background about what leucovorin is and maybe why it's different. I think explaining that, it is this different form of folic acid. And so if the idea is that your body isn't able to use that active form, then folic acid isn't going to be any better for you either. So that's at least something we can help rationalize. How would we help redirect patients? What other options can we provide if we're going to not be encouraging use?
Right. I mean, there are all sorts of little tiny studies out there looking at all sorts of pharmacotherapy to improve symptoms. Again, in a disorder that we don't really understand the causes of, and because of that have a hard time targeting therapy on. And I mean, and they can be pretty disparate stuff. I was asked, the DI Center got a question, it's probably less than 6 months ago, about memantine patients with severe autism spectrum disorder, and we actually looked it up, and gee, just like folinic acid, there's one little teeny tiny study that suggests that may have a benefit. But again, and my reply was, again, it's a small study. It was a very short term study. We just don't know. And memantine probably, very well may have long term side effects in, especially a developing child, right? So, unfortunately, you really can't point to pharmacotherapy that is going to address the root cause of the issue. I think we can use pharmacotherapy as adjunctive treatments to treat some of the behavioral issues, especially in severe autism patients. But unfortunately, as it stands now, we don't have good pharmacotherapy to treat this. And until we figure out the pathophysiology behind autism spectrum disorder, we are going to struggle to find treatments for it, because if you don't know the cause of something, it's very difficult to target treatments for them. So, and of course, as you pointed out, that's corollary to another announcement that was recently made by the federal government about causes of autism. That could be a whole nother podcast, but I don't know. Unfortunately, we direct them back to hopefully their child psychiatrists, child neurologists who are experts in treating autism, and say we're doing the best we can with what we have. But unfortunately, as it stands now, pharmacotherapy does not play a role in the treatment of autism. It can improve some of the side symptoms, but that's about it.
Or comorbidities like anxiety, depression. But yeah, absolutely. In terms of treating the condition, the autism spectrum disorder itself, there is no one. And part of it is just because it is a spectrum, right? And so there's varying symptoms, and patients are all, it's going to be a very individualized sort of management. So yeah.
And that's, I mean, you bring a good point that, because autism spectrum disorder can kind of fall into the whole area of neurodivergence. Millions of people have some level of neurodivergence, and they lead perfectly happy, healthy lives, right? And so, do we focus all our energies on the most severe symptoms, the most severe behavioral problems, the most severe sensory problems? That makes sense to me. If we're going to do a large randomized control trial on this, do we seek out the patients who probably need treatment the most? That makes sense to me. Will that actually happen is anybody's guess, but because of course, there's a pro and a con, right? If you have very, very severe symptoms, it's, because the improvements will be probably highest in patients with the most severe symptoms, it's probably going to be easiest to find a statistically significant difference, right? In this study. But also in the very severe patients, nothing or very few things may actually help, right? So it's going to be tricky. I really do hope that this becomes the impetus for somebody, probably the federal government, to fund a decent sized phase 3 study looking at this. I really do hope if that's going to be the end game of this, that's what really we should be looking at. Because there is the potential for benefit. There is, there are signals that it's going to work. We need to confirm that.
Yep. Yep. And just to clarify that this move for the approval is a very limited indication. It would be for the cerebral folate
Right,
deficiency, and so
right,
not
right.
the broad population that we think of with autism spectrum disorder. So,
Exactly.
um, well, fantastic. This has been a super interesting discussion, and just to wrap up our thoughts and sort of summarize where we are, we always end this podcast with a game changer. What were the game changers from this discussion? And so what would you summarize as our game changers and that listeners can take away and apply in their practices? What would
Right.
you break
I would
that down
say,
as?
the bullet point summary of this is that, FDA has announced that they're going to look at folinic acid, which is the activated form of folic acid, as a potential treatment for a condition similar to autism spectrum disorder, and that may provide the startup, or the jump start to get an actual study done. That current studies in patients with autism spectrum disorder and high dose folinic acid have been small, they've been short term, and they aren't really even close to the level of what we would expect for any other drug to get approved by the FDA. But the good news is that they have, shown some benefit. In particular, patients who have some sort of difficulty either activating folic acid to its active form or getting the drug into the central nervous system. So that's what we found. And the American Academy of Pediatrics believes that's not enough information, that we don't have enough information to look at efficacy or safety, and that even though theoretically there should be few side effects, there are a lot of unintended consequences. And again, to me, not least of which is running out of folinic acid
Mm-hmm.
to the
Mm-hmm.
people who we know absolutely will benefit from it.
Mm-hmm.
So I would not recommend its use at this time.
Okay. Well, fantastic. Thanks for that nice bottom line. You summarized it very well,
Thank you.
and really appreciate your expertise on this, Jeff. I mean, this is a tricky topic, lots of, interest and desire for useful treatments, but gotta go with where the evidence leads us. And in this case, yeah, sounds like we don't have what we need. So not yet.
Yeah, yeah.
All right. Well, thank you so much for your time. Appreciate it, Jeff.
Thank you.
Now, listeners, if you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at ceimpact.com. And as always, have a great week and keep learning. We can't wait to dig into another game-changing topic with you all next week. Here on Game Changers, we're all about helping you stay ahead of pharmacy practice. But why stop at listening? You can earn CE credit for this episode and hundreds more by visiting ceimpact.com and logging into your account or creating a new one. Get credit, get inspired, and make your learning count.